So today we're looking at a famous celebrity, Kylie Jenner. Why has she been looking weird? Particularly like the changes around her lip area and then also her lower eyelid area. Well, it's just been looking puffy. It's been not looking natural. It's been looking lumpy. When she was just 17 years old, she had fillers in her lips and she admitted this was something she felt self-conscious about. However, this is quite controversial because having a cosmetic procedure as a teenager, as potentially a child, is controversial in terms of ethics. And certainly in England, it is not legal to do this. But today, we're primarily interested in looking at this puffiness that she's been having. My name is Dr. Julian De Silva. I'm a board-certified facial cosmetic surgeon. My practice in central London, Harley Street, and I specialize in only facial treatments. So Kylie Jenner, well, before she had any treatments, she had this kind of sunken appearance in this under eye area. And so sometimes that can be a bit hollow. It can look a bit like kind of dark circles or shadows. And then after she had these fillers, this area looks smoother, more even, and it can work really nicely in giving a person a rejuvenation in this area. By making the area smoother, more even, a person could look fresher and younger. But more recently, this has been more in the tabloids because this area in Kylie has looked unusual. It's looked puffy. Why has this happened? I actually see this quite commonly, and I've been seeing and pioneering some of these treatments over the last decade. And this is a lady who came to see me some years ago with this kind of unusual puffiness, lumpiness in this lower eyelid area. And so this is something that is not unusual in facial treatments, but it's something that we need to get to the bottom of it because no one wants puffy or lumpy lower eyelid areas. Well, it is related to filler, but it could be the type of filler. It could be the technique that's used. It could be just too much filler being put in that area. And then the final factor is genetics. Things like malar bags, festoons are genetically related, and some people are a little bit more prone. And it can be difficult to determine which one of these is the causing factor, but it's not unusual because this area of the human anatomy, the lower eyelid area, the skin is incredibly thick. It's not a millimeter, it's not half a millimeter, it's half a millimeter in thickness. So the skin and the anatomy in this lower eyelid cheek area doesn't behave like the anatomy elsewhere. So fillers in this area need to be much more delicate and they need to be done in a way that's different to elsewhere. The only thing we can really do is dissolve the filler in the first instance. And that means using a filler antidote. That antidote is called Eyelid, and that will take away that filler. However, that doesn't necessarily mean it's going to look immediately better because when that filler is dissolved, it could look hollow because that filler has given volume in this area. And if the filler was done 6 months ago, a year ago, or even longer, it will go back to the point in time when you first had the filler, plus any aging in between. And of course, that is going to be a step backwards. And then what can we do about it? Well, either you can make a decision to put more filler. However, sometimes it's better just to say this filler does not work for this individual person, and it could be better to do lower blepharoplasty customized to that individual person. So this is a common procedure that I help patients with who've been frustrated with filler. It's given puffiness, it's given lumpy bumpiness. And lower eyelid surgery, well, it's a very delicate area, so it needs to be done with precision. And instead of using artificial filler, we can use your own fat. And that means taking a tiny amount of fat from around your belly button or elsewhere in the body, and we can concentrate that fat, and then putting tiny amounts in the lower eyelid area, it can make that area smoother and more even, and avoiding that puffiness that we associate with lower eyelids. So this is a patient of mine. She had this puffiness, irregularity, a bit like Kylie Jenner. It just doesn't look quite natural. Now dissolving the filler, well, she'd had this filler 4 years before, so it looked sunken, the skin had been stretched. But then with a combination of tailored lower blepharoplasty, fat transfer, resurfacing the skin with regenerative medicine, we're able to give a much more natural and smoother result. It's another patient of mine, this unusual puffiness. She came a great distance to see me because this had been seen by many doctors who didn't know what was going on. I dissolved the filler and that revealed puffy fat and this hollowing under eyes, and then treating that with lower eyelid procedure or surgery, known as blepharoplasty and fat transfer, that really improved this area. And using a technique that hides the scars on the inside of the eyelid, it can be very difficult to see this person's had any treatment. Too much filler, well, this is just not a good appearance because it just looks puffy. It doesn't look quite right, and particularly in young people, it can actually add age and years to you. And really, a natural appearance is smoother in the eyelid, and that gives people more confidence because it just looks natural. It just looks like you. So in conclusion, the journey between having one's ideal aesthetic, well, sometimes non-surgical treatments, fillers can be helpful. However, they aren't universally helpful because sometimes, specifically in this lower eyelid area, fillers can result in puffiness that just doesn't look right. And sometimes taking a step back, dissolving that filler, and then treating with lower eyelid surgery, blepharoplasty, the fat transfer, that can give just a better result. So, I do hope this information has been helpful for you. Thank you for watching. If you have any questions or thoughts on cosmetic surgery or on celebrity treatments, please don't hesitate to contact me. Thank you.